Separating the fact from the fiction out there. It's part of what we hope to do with KSAT Q&A and get a better understanding of some of the issues and the topics that we are facing as a city, as a state, and certainly as a country. Cherise Rohr-Allegrini is an epidemiologist. She's with the San Antonio AIDS Foundation. She joins us now. Cherise, thank you. And right off the top, you think of the White House. You think of one of the most secure facilities in the world, yet COVID-19 gets to the president. What does that tell you as an epidemiologist?
Well, we know this, that viruses can pretty much pass all physical barriers. All it does is it has to come in with the person, and we don't have a way of stopping that other than testing, but testing alone isn't enough. We also need to isolate immediately and quarantine all contacts. The fact that it spread so rampantly means that the White House wasn't doing the best practices that we all know to prevent the spread of COVID. So testing helps. It's not enough. You also have to quarantine, and you have to follow all the best practices like mask wearing and physical distancing.
You talk about testing, and that's something that really struck me in the aftermath of the president's news about him testing positive. How many people in his circle were quick to come out and say, I've been tested, I tested negative. Chris Christie, for example, said that, and then days later was in the hospital with COVID. So what do you think that should tell people about testing?
So testing is very useful, but it's a point in time. I could be negative today, and the virus just hasn't made enough copies to show up in a test. I heard Dr. Frieden, former head of the CDC, say that testing negative is not a get out of quarantine free card. It's only a point in time. It's useful information, but if we have been exposed, that's why we need to quarantine for 14 days, because that negative might not show infection just yet because you've tested too early, or it could be a false negative. And so you have to quarantine, you have to follow all those best practices if you know you've been exposed to somebody that has COVID.
Obviously, this is happening in an election season. The president is actually speaking right now live in Florida at a campaign event. What are, if you have to socialize, if you have to be out, what is the best way to mitigate the risks out there if you're going to socialize?
Sure. It's being cautious about socializing. And, it's really important that we don't want to say don't socialize. We're social beings. We need to interact with others. What we do say is limit it to what you need to do. Don't throw large mass gatherings. That's problematic. But any kind of time that you're interacting with others, keep a physical distance, 6 feet at least. Be outdoors. Again, it's not perfect, but it's better than indoors. And wear a mask and wear it properly and wear it the whole time. All of those things, they don't bring your risk down to zero, but they substantially reduce it. And if you follow those, there's a good chance we can have control of these diseases or this disease. But if you are going into a crowd of hundreds of people and you're not following the physical distancing guidelines and you're not wearing a mask, it's pretty much guaranteed that one person there is going to have it and could spread it to others.
Cherise, we've talked to you a couple of times throughout this pandemic, and we know that information has changed a lot in the last 7 months or so. Is there something that really stands out to you that you have learned about this virus since we last spoke, something you think people should know about?
What's interesting as well, the information has evolved. And for example, mask wearing. At the beginning, we said we didn't think they were protective. As we got new data, we felt that masks really did make a difference. And so we recommend mask wearing. That's a really obvious one. But I will say that a lot of what has happened is what we predicted as epidemiologists. The specifics of the virus are things that we're still learning, but we knew it was going to impact a low-income population. We knew it was going to impact people of color in a very negative way. And unfortunately, all that has come to pass.
Talk about aerosolization. Am I saying that right?
You are, yes. So that's another one where we've learned quite a lot. We do know it's droplet transmitted. And so it's not like measles where it's floating and living in the air for hours on end, but it can travel a little bit of a distance. And when you have an enclosed space, something that's confined and kind of trapped air, that virus is going to hang around a little while longer. And so you have the potential for transmission longer than if it was strictly droplet.
So we have to continue the mask wearing. We know that we've got businesses opening at extended capacity right now. How do you feel about where we are in San Antonio with this virus at the moment?
I'll tell you, I'm quite concerned. I was just looking at the data today, and our infection rate is really jumping. So it doesn't look that obvious when we just count the number of cases. But our infection rate has actually increased quite a lot in the last 2 weeks compared to the time period between August and mid-September. So that has me concerned. We're going into flu season, which is going to cause another challenge. I don't want to say close businesses because I think it's very important to keep them open, but we need to make sure we're working with businesses so they have the means to follow best practices. They can limit their capacity. They can have people wear masks. They can do all the things that are necessary to keep people safe within their business so they can still earn income, so they can pay their staff salaries and their staff can pay their rent and buy their food. It's the only way to continue our society. In this COVID is not going to go away. So we just have to get used to following all those protective measures.
She is a disease detective and epidemiologist, Cherise Rohr-Allegrini with the San Antonio AIDS Foundation, the CEO. Thank you so much for your time, and we'll see you tonight on The Night Beat.
Thank you so much. Bye.
We'll be right back.